there is always talk about increasing domestic resources. And now it's actually no longer increasing. We have to accelerate the implementation of those plans. And there's several ways I think countries can look at this. Number one, you do have institutional investors on the continent, and they have been an undertapped resource for so long. When I look at pension funds, right, on the continent, estimated to hold $700 billion in assets. How can those assets, and that's pension capital, how can you redeploy some of that asset to invest, for example, in healthcare infrastructure? How can you redeploy those assets to perhaps even strategically mobilize pension funds resources from Europe or America to come and complement what is happening on the ground to do different things? So I think there's ways countries need to start looking at what they have internally and figuring out how they can use that as a leverage to crowd in more resources. And I think pension funds and other institutional vehicles could be one of those things that can help really not only increase investments, but also provide that catalytic funding that's needed to crowd, to get the private sector to engage.
Danielle, we're of course talking as there's a new recent Ebola outbreak, of course. What is that exposing to you? Does it show that potentially the models that are being rolled out in several dozens of African countries at this point in time, the America First models, are not necessarily what is needed? Does it in fact describe or show that the USAID and some of the systems that were in place were not as resilient as they needed to be? I wonder what this recent outbreak is indicative for you.
I think for me, what this outbreak exposes is the need for countries to have permanent intergovernmental structures that are empowered, that have the mandate and the authority and the flexibility to deploy resources strategically and where they're needed most. Currently, what you have, and it's we have the building block, and I think that's the role that USAID has done, building those foundations across the board. USAID was there helping build out the One Health platforms that we talk about, where you bring different sectors together. USAID working with the World Health Organization and other partners helped put in place incident commands that are now operational in many of these outbreak responses. For me, what this has exposed is that countries must take this seriously, particularly because we are in a moment where it's very clear that we're going to continue confronting these diseases.
On these U.S. bilateral health deals, we've seen a number of countries actually decline some of the agreements. What would you say is the chief concern among some of these countries about these agreements?
There are elements that need to still be negotiated. I think it's a good first step because countries had been asking to be in the driver's seat of their own health programs, and that's fantastic. It was a direction of travel that we were on anyways. So this only further continues it. But I think what we need to be careful about is to figure out how are these bilateral agreements going to be operationalized? The devil is in the details. Who is going to be doing what, where, and how? Where are we going to see the mutual accountability? I think those are the questions that we need to be asking of these bilateral health agreements. I think they mean well, but I think it's really for us to kind of look at how are they building on what was already there, the foundation, and then how are countries in the partner being the U.S. Holding each other accountable